audience we have here?
Are you talking to me?
Yeah, Dr. Price, I'm infectious disease.
So my name is Todd Price. I'm an infectious disease specialist here in Houston, Texas, and kind of leader in the infectious disease section at my hospital, which is a relatively large hospital. And so I do work here. Then I do work in different places around the world too. So part of what I do is we have projects. I've had projects in about 40 countries. And one we're working on right now is in Uganda, around the border of Uganda and the Congo, where we're trying to decrease the amount of intestinal parasites in children. And we've done that. We've gone from 74% down to 15% in about 4 years. So briefly, that's me. And so we've been taking care of a lot of the coronavirus patients here in Houston. So.
دكتور برايس، شرف وسعادة أن تكون معنا اليوم. شكرا لانضمامك لنا، شكرا لتعريفك الجميل. رح أبدأ فورا بسؤال بسيط لكن معقد. السؤال هو ما هي خصائص أو خاصيات فيروس كورونا؟
What is the characteristic of the virus COVID-19?
Well, I have a PowerPoint and I can show you some if that's okay. I can share that with you. Would that be okay?
Yes,
please.
Let's see if I can work this out. Can you see the screen?
Yes.
Yes.
Okay. So coronavirus is an envelope virus. It's an RNA virus. It has wildly spaced little spikes that resemble a crown, and that's why they call it coronavirus. It's the cause of the common cold. There's about 4 serotypes that cause the common cold. Here in the United States, about 35% of the upper respiratory tract infections are due to coronavirus. And sometimes they cause severe infections in children, but that's not very common. It can cause diarrhea. And then there's been some cases of encephalitis. So that's the characteristics of the coronavirus. Should I go on? Should I talk about the other viruses?
سؤالي مرتبط باليوم، ما هي الفيروسات المعروفة لدينا والأقرب لفيروس كورونا؟
What is the viruses that we're aware and we know it that is close to this coronavirus?
Yes, okay, so the first one, other than those that cause a common cold, the first one that appeared was in China back in 2003, February 2003, in a city down south, a little bit further south than Wuhan, in Guangzhou. There were some patients that developed respiratory illness, and they found that this was SARS, or severe acute respiratory syndrome. And this was due to a coronavirus. It's thought that it was, the definitive host was a horseshoe bat, and the intermediate host was the palm civet, which I don't know if you can see this, but pictured here.
Mm-hmm.
So this was very infectious, and it adapted, and it was transmitted by airborne and fecal oral and by fomites. And the incubation period of this virus was 2 to 10 days. And it kind of went away after a few seasons because it's thought that the community developed host or herd immunity. Then what you are probably more familiar with in the Middle East is MERS, or Middle East Respiratory Syndrome. That's also the coronavirus. And so this was a little bit different than SARS in that the reservoir again was a bat, intermediate host was a camel. And so it was not quite as infectious, although it was more in clusters. So like family members were more likely to get this particular virus. And so I think, you can correct me if I'm wrong, but I think it's still somewhat, it occurs still in the Middle East. So because I don't think enough people have acquired it for herd immunity to develop. So those are the two viruses that we know of.
You got that, Dr. Fadi?
إذا دكتور برايس كان يحكي إنه مثل ما بنعرف هلا صرنا كلنا إنه كورونا فيروس في له أحفاد سابقين، أولهم هو السارس اللي انتشر في الصين، وميرس اللي انتجت في منطقتنا، وميرس كان الناقل الأساسي له الجرذان والجمال. فهو إذا ليس من عائلة قريبة، من عائلة غريبة عنا، الحمد لله موجود في المنطقة. هو من عائلة موجودة. الكورونا فيروس أو الكوفيد 19 هو أحدث واحد. أنتقل للسؤال الثالث، على ماذا اعتمدت منظمة الصحة العالمية أو World Health Organization لتصنيف مرض كورونا كوباء؟ وما الفرق بينه وبين الإبيديميك أو الجائحة؟
Dr. Price, Dr. Fadi is asking, how did the WHO had classified it as a virus, and why did it become an epidemic? A pandemic.
Pandemic.
Okay, well, it was reported at the end of 2019 in Wuhan, in Hubei province, and at that point, it was reported by the Chinese government that it was not human-to-human spread, but in fact it was. So I'm not trying to be critical here, but the Chinese government did shut down travel from Wuhan to different parts of China, but they did not shut down international travel. So even though the planes from Wuhan to like Beijing or Shanghai were shut down, travel from Wuhan to San Francisco, to Tokyo, to Manila, to Jeddah, to other places were not shut down. There was a lot of travel between China and Italy because many Italian factories are serviced by Chinese workers. Also, there was a lot of travel between Wuhan and Iran because of holy sites in Iran. So, so unfortunately, it was human-to-human spread, and it appeared that this was the case early on, and travel to international travel from China persisted, although travel from Wuhan to other parts of China were shut down by the Chinese government, and that's how it spread.
Clear. So I will ask a question as next. What's the difference between pandemic and epidemic?
That's a good question. So pandemic is essentially, you can have an epidemic, you have local epidemics. Pandemic is a worldwide epidemic. So you can have an epidemic of like cholera, like where I work in Africa, there are epidemics of cholera localized. But when the epidemic becomes worldwide, that's when it's termed pandemic.
Perfect. دكتور برايس، بداية عرف البانديميك هو الوباء العالمي لما ينتشر عالميا فهو بانديميك، ولما يكون محليا مثل كوليرا في بعض أماكن أفريقيا هي بتكون epidemic أو جائحة. دكتور برايس ذكر نقطة مهمة جدا أعتقد لازم كلنا نعرفها. انتقال المرض من ووهان إلى بقية العالم كان سهل جدا بسبب التنقلات، وهو عنده تحفظات على الحكومة الصينية في أنها لم تبرر أو لم تشرح بالتحديد أنه الوباء أو المرض ممكن ينتقل من شخص إلى آخر، من بشر لآخر. في عدة نقاط استفهام كانت الحقيقة عند الجميع، وكان شرحها دكتور برايس ببساطة جدا. انتقال الوباء من ووهان في الصين إلى بكين، شنغهاي، سان فرانسيسكو، مانيلا وجدة والمنطقة العربية بسبب كثرة الاتصالات الجوية، بالتأكيد انتقالات الطائرة. انتقل إلى إيطاليا بسرعة بسبب وجود العديد من المصانع الإيطالية في الصين، وانتقل إلى إيران حسب تفسير الدكتور برايس بسبب الصلات الدينية بين الصين وإيران. راح انتقل للسؤال الرابع. عندما يسمع الناس عن اللقاح بيعتقدوا أن اللقاح هو شيء سحري وسيزيل المرض 100%، لكن مثل ما بنعلم أنه حتى لقاح الإنفلونزا قسم كبير من الناس أو قسم من الناس خلينا نقول اللي بياخذوا اللقاح ما يزالوا معرضين أنه يتعرضوا للإصابة رغم أنهم تلقحوا ضد الإنفلونزا. ايش رايك اذا بموضوع اللقاح في كورونا، هل هو ينطبق على نفس السيناريو عليه؟
Dr. Price, Dr. Fadi is asking about a lot of people are assuming that the vaccine is a magic preventative approach that everyone is looking forward to it, as if they're gonna take it, they will never be infected with the COVID-19. But we know, as for the flu virus, I could be vaccinated and I still can have the flu throughout the season of the flu. So why we're putting so much hopes on the vaccine?
A vaccine is not guaranteed to arrive. So, they're working on a vaccine, and it does take some months, 12 to 18 months for a vaccine to develop. We do have a vaccine for some viral infections, like measles and mumps, but and we have the vaccine for influenza, which has to change every year because of antigenic shift and antigenic drift. But we're hoping that we will have a vaccine for coronavirus. So many vaccines are in development at the present time.
So do you believe if we have vaccine, it will have the same shape of coronavirus? We may, even if we have, let's say, a vaccine within 12 to 18 months, is it possible that we will need to have another shape of vaccine every year?
Well, it depends on, I'm not in the vaccine development, but what they will do is they'll get a protein that the virus uses to enter the cell or to attach to the cell, and so that they can inject into a individual, and that individual will develop antibodies to that particular protein, and therefore, when the individual is exposed to the virus, then that individual already has antibodies and it will destroy it, or it will keep the virus from attaching. It depends on the protein that they use. So it could be the protein that the virus uses to attach to the virus, to the nasopharyngeal cells, or it could be a protein that the virus uses to enter into the cells. So it is an RNA virus. And so there are many, many different proteins they could utilize, but it would make sense they would use a protein that the virus uses to attach to the cell.
So that will take a lot of practice, right? They need lots of trials. That's why it's taking 12 to 18 months, correct?
That's correct.
إذا دكتور برايس لا يقول مثل ما بنعرف اللقاح لا يضمن الشفاء في معظم الحالات. صحيح نحن عندنا لقاحات الحصبة والإنفلونزا والقليل من الفيروسات، لكن مثل فيروس الإنفلونزا بيتغير البروتين تبعه من فترة لأخرى، فبنضطر نغير اللقاح سنويا، وهذا الشيء متوقع وممكن ومحتمل في فيروس كورونا لا سمح الله، لكن بنحطه ضمن الاحتمالات. الفيروس هو RNA فيروس، فبيعتمد على البروتين اللي حواليه كثير، فبالتالي ممكن يغير شكله بعدة أشكال. أنتقل للسؤال الخامس. الشركات الكبرى، الشركات الدوائية الكبرى تعمل على إصدار لقاح أو علاج. برأيك دكتور برايس ما هو الإطار الزمني المتوقع للحصول على لقاح؟ جاوبنا عليه هو من 12 ل 18 شهر، لكن ما هو الإطار العملي أو الواقعي للحصول على علاج؟
So we talked about vaccines, and we talked about this big drug companies that they're working on a vaccine, and the universities as well. So this is for prevention, or maybe to make it less harmful when it attacks the human being. He's saying, so what about the treatment? What do you think of the treatment from the corona?
So there are various medications that, can you see the screen, or are you seeing the PowerPoint or no?
Yes.
Yeah.
It's
a little bit cut off unless you go to the slide itself.
Yeah, okay, so let's, let me see if I can bring it up again. Can you see it now or no?
It is not a full, you need to just lift it up, yes.
Yeah.
All right, okay, sorry about that. So, okay, so, so there are various treatments that have been utilized, and is an RNA virus. So it's thought that other medications that are used for AIDS, HIV, which is an RNA virus, also might work. So they tried lopinavir, ritonavir, which is a protease inhibitor. And initial studies indicate some benefits, but further studies indicate that this has not worked as well as they would like. But it was helpful in many patients in Thailand. So another treatment is hydroxychloroquine and azithromycin. They did use hydroxychloroquine in China with some questionable results. And then they had a study published out of France that indicated that this combination was beneficial for patients with COVID. So the theory with hydroxychloroquine is that in a test tube in vitro, it decreases attachment of the virus to the nasopharyngeal cells, and it also decreased the production of the virus by the virus itself. And then the final thing that it does, since with this virus we're finding that there's a cytotoxic storm, it also ameliorates the immune response. So it's an immune suppressant. With azithromycin, this is an antibiotic, it also has immunosuppressive activity, but it's mainly utilized for its antibacterial activity, because in many viruses, as you know, a bacterial component or a subsequent bacterial infection does occur. Like in the influenza pandemic 1917 and 1918, most of the people that died from bacterial pneumonia. And of course, back then there were no antibiotics. So hydroxychloroquine and azithromycin have been somewhat beneficial. Of course, but there's not been any controlled studies on any of these drugs, so this is just what we're trying. Then we've also tried a drug that they formulated for Ebola. It didn't work so well against Ebola, but it's a broad-spectrum antiviral called remdesivir, and it inhibits the viral replication through termination of RNA transcription. And so it is an experimental drug, which means that you have to enroll in the trial. So the advantage of hydroxychloroquine and azithromycin is it's already available. It's used, those medicines are used for other things, of course. And it's cheap. And so it's available. The disadvantage of remdesivir is not available. It's a study drug and you have to enroll with Gilead. That's the problem. Then there's convalescent plasma. So in many diseases throughout the years, like measles and diphtheria, those who recovered from diphtheria or measles, or in this case, COVID, develop antibodies. So if you take their antibodies, their serum, and give it to patients who are acutely ill, then you're giving the patient antibodies, and therefore they're much able to get rid of the infection. There's also medicines we use to decrease the immune response. So interleukin-6 is greatly exaggerated in this particular disease, And so interleukin-6 inhibitors have been utilized. It's a one-time dose. It is available. It's a little more expensive than hydroxychloroquine, but when patients are really, really sick, where their lungs are failing, then interleukin-6 inhibitors would be helpful. There's other medicines that have been used in Africa and also in Japan. Ivermectin is, of course, an antiparasitic drug, and it works in a test tube, but so far has not been very helpful in patients because the amount of ivermectin that you utilize to get what is beneficial in a test tube is toxic to the patient. Then the Avigan, which is a flu drug that is used in Japan, is also in a study. So those are the treatments. There are some other problems with this particular virus. There's some medicines we like to avoid. So typically we like to avoid steroids if we can, although we have used steroids. And with many viruses, NSAIDs are not recommended. And some cardiovascular medications like angiotensin-converting enzyme inhibitors actually unmask the receptor site for the virus in the nasopharyngeal cells. So those are under study of whether these are just theoretic, and they're under study of whether these are harmful to the patient.
Great, thank you. إذن بالنسبة للعلاج مو في علاج واحد، في عدة علاجات أو عدة نظريات تحقيق العلاج. واحد منها هي علاجات الأدوية المضادة للإيدز. لوبينافير استخدم في تايلاند لكن لم تفلح بشكل حقيقي. في الصين بيستخدموا العلاج اللي سمعنا فيه كنا اللي هو هيدروكسيكلوركين مع الازيثرومايسين او ازيثروماكس. في كثير من علامات الاستفهام حول هذا العلاج، وكلها اختبارات كانت حصلت في المختبر وليس على بشر. ممكن للاسف انه الهيدروكسيكلوركين باعتباره مثبط مناعي ممكن انه يسبب انسمام، والازيثروماكس او الازيثرومايسين نستخدمه نحن لعلاج البكتيريا المرافقه للفيروسات. وبهالحاله كثير من الامراض او كثير من حالات الوفاه تحدث نتيجه الاصابه الجرثوميه اكثر منها الاصابه الفيروسيه. امتياز الهيدروكسيكلوركين والازيثروماكس هو انهم متوفرين ورخيصين وقابلين للاستخدام. علاجات اخرى، احد العلاج في افريقيا اللي كان يعالج تحت العلاج الايبولا اللي هو ريمديسيفير تحت الاختبار، للاسف غير متوفر حاليا، بتنتج شركه جاليادين. البلازما او ناخذ اللي هو القسم اللي بناخذ المصل من او الانتي بوديز من مش الانتي بوديز الانتي فيروس من مريض مصاب خلينا نقول لمريض معافى، ونحن في مريض مصاب لعلاجه برضه تحت الدراسه. في احد العلاجات الواعده الحقيقه اللي هو انترلوكين 6 متوفر لكنه غالي الثمن ويعطى كجرعه واحده وفي الحالات الشديده. في افريقيا واليابان بيستخدموا ادويه ثانيه، ايفرمكتين اللي هو بيستخدموا لعلاج السكيبس او الجرب، مشكلته انه تحت الدراسه وممكن يكون بجرعات سميه لا سمح الله. من المهم جدا اللي ذكره الدكتور براس انه في اثناء العلاج لازم نتجنب عده ادويه، في منها طبيه انتم ما بتعرفوا فيها، مش كثير الاطباء بيعرفوا، لكن المستمعين حيهتموا انه ممنوع استخدام الكورتيزون، ممنوع استخدام نون ستيرويد انتي انفلاماتوريز مثل البروفين، الكيتوفين واشباههم. السؤال السادس له علاقه بالسؤال اللي قبله، وهو متى يحتاج المريض لاستخدام هذه العلاجات؟ نحن بنعرف انه في عدد وقسم كبير من الناس تم علاجهم في المنزل وشفوا في المنزل، فبالتالي يطرح سؤال نفسه متى يجب استخدام هذه الأدوية.
Dr. Price?
Yep.
So say the question again. Can we exit the slide so we can have a complete picture, Dr. Price?
If we know that there's many patients are recovering by being sitting home and they have mild or minor symptoms, when it's time to use, when we decide that we start to use those medication?
So if not everyone needs medications.
Mm-hmm.
So it is thought that maybe 70%, 80% of patients who get exposed to this coronavirus, some do not get that sick. Some may even be asymptomatic. And therefore, obviously, those who are in that category do not need medications. If they go without taking medications, then those 78% of the patients who are exposed will not have any deleterious, it does not appear they have any major side effects. They just develop antibodies and they're protected and they can be utilized for plasma, convalescent plasma in the future for other patients.
Any everlasting side effects from them being infected from it that will stay with them for a long time after?
Okay,
the ones that didn't go to a hospital, the ones that recovered at home. Does COVID leaves anything behind?
It is not thought that that's the case. It is thought that all these things, we're just learning these things. And so it appears at this point that those patients who were asymptomatic or had a mild case of coronavirus and did not require hospitalization, they will not have any long-term effects.
Okay.
They will not have any time effects.
That is correct.
So what about those who really had the medication? Is there any possible side effects, long-term side effects? هل من تأثيرات مستقبلية للعلاج بعلاجات كورونا الحالية؟
For the ones that goes in the hospital and get treated and they leave, if there's anything that it will stay with them?
There's no long-term studies, but according to experience.
Well, according to my limited experience with about 100 patients, and the patients I see require hospitalization. I don't see the patients who do not require hospitalization. So a small percentage of people have major pulmonary problems, and to the point where they require mechanical ventilation. They also are therefore at increased risk of developing bacterial infections. So for the most part, people who require mechanical ventilation are able to be treated and they come off the mechanical ventilation without major serious effects. The virus, however, is thought to cause thrombosis in the small blood vessels of the lungs. And therefore, the peripheral part of the lungs, it's thought could be damaged. Now, whether that has any long-term effects is not known. If a patient develops a bacterial infection, such as pneumonia or even empyema, and requires surgeries for that, then of course there may be some long-term effects because of that. But the virus itself is not clear for most people. For most people, it's not a problem. But for a small percentage of people, there may be some long-term complications.
Thank you, Dr. Price. I may translate this if you don't mind.
Yes.
جوابا على سؤالنا، مش كل الحالات حيصير في أعراض مثل ما بنعرف. 70 ل 80% من الحالات ممكن يصابوا بالمرض بدون أن يبدوا أي أعراض إطلاقا أو أعراض طفيفة، وهدول ممكن نستفيد منهم بين قوسين. ممكن نستفيد منهم إذا كان الوصف المناسب لاحقنا في الناس المصابين. السؤال المهم والأكثر أهمية والحقيقة اللي ما حدا طرحه، الناس اللي عالجت أو تعالجت من فيروس كورونا، إيش التأثيرات الجانبية طويلة الأمد اللي بتصيبها؟ الدكتور من خبرته اللي قال حوالي 100 مريض كانوا في المستشفى، احتمال نتيجة التهوية الصناعية اللي بيحتاجوها، أحيانا بصير نتيجة المرض بحد ذاته في تجلط في الأوعية الدموية الدقيقة في الرئة، هذا احتمال يعمل أذية، ممكن إنه لسوء الحظ تكون طويلة الأمد، لكن هذا غير معروف في الوقت الحالي. ممكن بعضهم يصاب بالتهاب بكتيري مثل النمونيا ويحتاجوا لجراحات يكون لها تأثيرات طويلة الأمد. We are almost there, Dr. Price. I know. I hope we did not get you bored. I know,
you have one important question.
I believe you are facing this hundreds of time. I believe I just checked your profile. I think I'm as I told you, I'm honored to have you here. I checked that you are really great man. All respect for what you do. So I think a great man like you will have the patience for a couple of more questions.
Of course, no problem.
Thank you, sir. السؤال الثامن مهم للناس عموما. أيهما أفضل برأيك لمواجهة الوباء؟ هل هي سياسة الحظر الكلي أم مناعة القطيع؟ ما بعرف إذا حتعرفي تترجميهم.
What is the best way to help the society to prevent COVID-19? Is it by the quarantine or by total isolation of people?
No, not
right?
total isolation.
Is that what you meant?
No, I mean, is it the total isolation and quarantine, or let everyone get the
social distance and be back to normal?
No, get infected, actually infected, let everyone get infected, and we increase the immunity for everyone. There is some theory that you get everyone infected, at the end you will get the most popularity have immunity.
So the majority will start to carry that antibodies from COVID.
Yeah, okay, I understand that. That's a very good question. What we're doing with this particular virus, we've never done before. And this social distancing and quarantine. Normally in the past, we would quarantine people who were sick, but now we're quarantining everybody, essentially. So the question is whether that's decreasing the ability of the herd, the people, the population, to develop herd immunity. And that's a good question. So when they first predicted the numbers of people who would become ill and the numbers of people who would die from this particular virus, I think it was over-exaggerated. In the United States, they anticipated 2 to 2.2 million people would die. And I thought that was no way that was going to happen. So they did social distancing, and it did not happen. The question, though, is, did the social distancing cause the numbers of deaths to go down? Or was it going to be that way anyway? That's a good question. We don't know. I do agree that our cultural habits of shaking hands is probably not a good idea. And wearing masks essentially was introduced because of the asymptomatic spread of this disease. Therefore, the mask wearer is not being protected from infection, but the mask wearer is protecting others from him or herself. So we wear the mask, put the mask on to prevent other people in the room become infected from us, because we may be asymptomatic and we might be shedding it. The other thing the mask does, it keeps your hands off your face. So washing hands, keep your hands off your face, especially your eyes, your mouth, any mucosal surfaces, will decrease the spread of this particular disease. Closing down restaurants and closing down different stores probably helps, but I don't know if that's the total cause of the numbers of deaths and the numbers of diseases going down. But you could also say that by doing that, we're decreasing the chance of herd immunity to develop. So there's some places, like in Sweden, where they did not social distance. And it'll be very interesting to see if their herd immunity is higher in that particular country than the other countries that do social distancing. There have been studies in New York and also California that many people have developed antibodies who were never sick. So in California, there was reported to be 7,000 cases, but when they did a study of antibody test, 15% of Californians had the antibodies. And so that's much, much more than 7,000, more like 700,000. So I don't know if I answered the question correctly to your liking, but I think social distancing
answered it with a lot of more questionable answers.
But herd immunity may, by social distancing, herd immunity may be.
Sorry. Hello?
Yes.
Yeah, by social distancing. It's clear for me. It's clear. I agree, and I will just have one comment on what you said, Dr. براس. دكتور برايس، أنا أقول من المهم جدا إنه نعرف إنه ما نقوم به الآن لم نقم به سابقا. سابقا كان الحظر أو الكارانتين نقوم به للأشخاص المصابين. حاليا نقوم بالحظر للجميع. السؤال: هل ينفع الحظر أو لا؟ برأي الدكتور برايس إنه تم المبالغة في تقدير الوفيات في المرض. كان متوقع في أمريكا أنه يصاب أو يتم وفاة 2,000,000 شخص، لكن هذا برأيه ما حيحدث إطلاقا. السوشيال ديستانسز أو التباعد الاجتماعي هل يحقق هذا؟ ما في شيء أكيد برأي الدكتور برايس. برأي المصافحة شيك هاندز هي مش شغلة جيدة. الماسك يحمي الآخرين من المصابين. وهذا حكون أنا حرجع للدكتور برايس في سؤال. الإغلاق قد يفيد، إغلاق المحلات والمطاعم والى آخره قد يفيد، لكن لا دليل على شيء، لكن يفيد في تقليل الحالات، وهذا منطقي. الدراسات الغير مبشرة أنا برأيي في نيويورك كاليفورنيا، العديد من الأشخاص 7,000 حالة في كاليفورنيا لم يتعرضوا للاختلاط مع أي شخص، و50% من سكان كاليفورنيا لديهم مضادات للفيروس. أعتقد هذا رقمين لازم نفكر فيهم.
مع انهم ما
نعمل هايلايت عليهم. نعمل هايلايت عليهم بعدين.
بيحملوا الاشياء المضاده لكنهم لم ينصابوا.
ولم يصابوا.
Interesting, very interesting.
50% لديهم مضادات الفيروس ولم يصابوا. 7,000 شخص لم يتعرضوا للاختلاط مع أي حد ثاني. Interesting. Dr. Price, about just a small question about mask. There's I believe myself that we have never, as a doctor, I'm physician. I never seen any other issue in medical that have misunderstanding and misinformation as much as COVID-19. I believe this it's one of media issue. Small thing, but might be matter is a mask. There's many or two theories about masks. Some who says those who have infection should wear mask. Others they said everyone should wear mask. What do you believe?
Well, there's never been real studies that would indicate that a surgical mask or a mask of any type will prevent the wearer from getting the disease. So once you wear the mask for 30 minutes or 40 minutes, the mask has become moist from your breath. And therefore, it may no longer be a protectant, but may be an attractant. So wearing a mask to prevent disease for long periods of time have never been proven to be protective. In this situation, in COVID, initially, the experts indicated that wearing a mask did not help you. Now, if you're a nurse, if you're a healthcare provider, you're a physician, you go into a room where a patient is and say that that patient is intubated on the ventilator or just had a bronchoscopy, then there's a lot of air droplets in the air. Then wearing an N95 mask would be protective. But wearing generally in the population has never been proven to protect. So now, the reason for the mask is to prevent the wearer from transmitting to other patients, to other people. Now, has that been proven? No. None of this has been proven. So I agree. A lot of the things that are in the media, a lot of things that are being said have no scientific basis. you could say also that social distancing doesn't really have a lot of scientific basis either. It makes sense. But as you know, as a physician, things that make sense don't always turn out to do the job. So I agree that the mask is a controversial subject.
And I liked your input about the mask, that the mask will help us not to touch our faces more than it's really protecting us from the virus. It's just
that is correct. That is correct.
Covering more of our face.
Yes.
إذا سألخص باختصار عن الماسك لا يقي من الإصابة 30 ل 40 دقيقة الماسك سيصبح راح يصير رطب وممكن يكون عامل جذب للفيروسات. إذا كنت من طاقم طبي فلازم تلبس N95 وهذا شيء معروف. بالنهاية في العديد من الإشاعات لا أساس لها من الصحة. الماسك واحد من الأمور الجدلية حتى في الوسط الطبي، لم يثبت إنه ممكن يقي من الإصابة ولم يثبت إنه يجب أن ترتديه طول الوقت. So we talk about just to shortcut. تحدثنا عن البلازما بعد نجاحها في علاج عدة حالات. هل البلازما ستكون إحدى الخيارات الواعدة في المستقبل القريب؟
Is the plasma going to be one of a promising treatment in the future, do you think?
Yeah, I think so. I think plasma therapy, plasma convalescent therapy will be probably what we will lean on for the most. I think that has the most promise. Now, if the vaccine is developed and the vaccine works, then plasma becomes less important. And we know that because they used to use plasma for diphtheria, but we no longer use plasma for diphtheria because we have the diphtheria vaccine. Same thing for measles. You used to use plasma or immunoglobulin shots for measles. We no longer use that because we have the measles vaccine, which is 80, 85, 95% protective. So, but at least for the short term, I think convalescent plasma would be very useful and probably has the most promise of all the therapies that have been proposed.
Makes sense. Very interesting.
So I take it as I take it as yes. إذن دكتور برايس بيقول إنه ممكن جدا البلازما المأخوذة من الناس مصابين وحقنا في من الناس متعافين وحقنا في المصابين ممكن يكون الخيار الأفضل حتى الآن. لكن بكل الحالات عند حصولنا على اللقاح ما بعود لها داعي مثل الأمراض الأخرى اللي كنا حصلنا على اللقاح مثل الحصبة وغيرها. Last not the least question دكتور برايس. الكثير مرة ثانية نرجع من الإشاعات والفهم الخاطئ للوباء.
I failed to take care of this. I hope that is not spoiling it.
No. إذا الكثير من الإشاعات والفهم الخاطئ للوباء. واحد من الإشاعات، هل تؤمن إنه حقيقة هناك دور لشبكات الجيل الخامس في تفشي الوباء؟ هذا سؤال مرح.
He thinks this is a funny question, but we're gonna have to ask it to you.
Yeah, I have to.
But it's popular among the people. They're asking if the G5 has any effect into all what happened, or is it adding, or it was a cause even of all this? The G5, which is.
I'm sure you hear about this one.
Yeah, I mean, we don't have G5 in US. We don't have enough towers for it. People are fighting that. They don't want it close to homes. They don't want it close to where we are working. So now when I went to Saudi Arabia, I think there is more G5, right, Dr. Fadi?
Yeah, there's more G5 in Saudi Arabia, in Italy, in Wuhan. Actually, this is where this theory came from. That in Wuhan, Italy, Spain, Middle East, there's more these cases for those who have G5 rather than those who don't have. Do you believe?
Did any medical research looked into it?
Yeah, that's something. There's many things that we don't know about this virus, and many things about immunity that we don't know, and that's something to look at. So I'm not discounting it. It's a little funny, but not discounting anything.
Okay. Last question I will ask you, Doctor. I know that you have been and you have seen a lot of those diseases, but as for us as a newcomer to this field, I will ask you what the lesson you learned from Corona specifically.
You see, one lesson.
Many lessons. Tell us a few.
Okay, there's many lessons, but one lesson, it would be better if we leave politics out of medicine.
Thank you. Very, very, very perfect answer.
So it would be better. I'm not anti-Trump. I'm not pro-Trump, and I think a lot of things he says, he's just trying to help, and a lot of things he says he shouldn't say. But what he said about hydroxychloroquine, the opposite political camp just attacked, and that can sometimes be a detriment to the patients. So what are we doctors? We are treating physicians. What are the healthcare providers supposed to do? We have this new virus. We don't have any specific therapy, and there is some hope that hydroxychloroquine would work. But when we want to use it, then there's so much in the airwaves about how it's not good, it's not good for you, when in fact it is not the case. In my experience, it works very well. So the one thing I wish is we could somehow leave politics out of medicine.
So it does interfere between what the physician is offering his patient, because the patient is listening to all this as if it's rumors and TV and news media, and everybody is becoming a medical expert at this point, and they're speaking of a lot.
So the media, social media, the media, in some respects is evil.
It is.
Except when you want to download a movie.
That was the best part of it.
But maybe you should be watching the movie anyway. So.
I would agree. I'm not into American politics, but I believe I would agree with you. Here in our area, politics they are doing really good, especially here in Saudi Arabia. They are really doing great. MOH Minister, they are doing really good job. But I would prefer that if we keep social media influencers, especially out of this issue, that would help a lot of medicine team to get better results. Yes, I believe the rumors played a bad impact in this, especially for those ignorant or those who are only in social media. They won't just take advantage from this situation.
Yes.
And fake videos, I'm sorry. I mean, there's a whole lot of fake videos, and it is really very interesting how the people are using it and they're distributing it. And now anyone would distribute something to me. Of course, I have minimal people now is doing that because they're so afraid to send it to me. It's just, I'm saying, did you know this news reporter? Do you know this news channel? Do you know this doctor? Did they identify themselves as a doctor? Have you looked him up? He is not even there. He's speaking an opinion. An opinion is different than an experienced, medical teams who is working on this. And I think the people are not differentiating this, and they are freaking out. And if you heard what Dr. Price said at the beginning, Dr. Fadi, he said that there's patients who should have been in the hospital and came much earlier. They are too terrified to come. So they're coming really late and they're really sick. So it's just two-edged sword.
Unfortunately. Unfortunately, I say always that social media, it may play a good role for education or for getting people have better knowledge or worse knowledge. أو السوشيال ميديا هي وسيلة نشر الجهل أو العلم للأسف حسب مين بيستخدمها. Absolutely,
it depends on who's using that social media.
Dr. Price, I have no enough to thank you for your precious time. I appreciate it. It was really pleasant and fruitful talking to you. عبير شكرا جزيلا لك. أنا عايز عن شكرك لك Dr. Price على المعلومات.
Thank you so much, Dr. Price. I really appreciate it.
We hope that we add, for myself, I hope that I add even small
Please do.
positive in this side. I believe it's my mission. But whatever we do, Dr. Price, I think we just do a little bit comparing to what we do. All respect, sir.
Thank you very much. My pleasure.
Thank you. And you take care of yourself.
Yes.
You too. Have a great day.
Okay, thank you.
Bye-bye.